This is actually quite amazing. There is zero evidence that depression is a chemical imbalance in the brain involving serotonin, despite years of selling massive amount of drugs. The amount of money that these drug companies made on this theory is astronomical. It's only a theory, and there's no evidence that increasing or decreasing serotonin in the brain does anything for depression. It has been found that SSRIs, selective serotonin reuptake inhibitors, basically these are medications to block the reuptake or the absorption of serotonin so you'll have more serotonin in the brain. They have found that when you give someone this drug, it does increase, at least temporarily, the available serotonin in the brain. The drug trials on SSRIs show that these antidepressants are barely indistinguishable from the actual drug and the placebo in treating depression. But they come with a package, a lot of side effects, including something called a black box warning. In fact, all psychiatric drugs have a black box warning, which means they have a high risk of suicide thoughts and behaviors. But on top of that, there's some serious side effects involving the sex organs. I'm talking about a lack of orgasm, penile and genital anesthesia, which is the loss of feeling of your private parts, erectile dysfunction, premature ejaculation. So it's just bizarre to me that we have all these high risk for side effects, yet we don't have any evidence on this theory that it actually will work for you. There's even some research that shows that it's the elevation, it's the high levels of serotonin that causes depression, not low levels. And in other experiments where they actually tried to lower serotonin, they did not find that a person gets depressed when you lower their serotonin. So, as far as the treatment of depression with pharmaceuticals, you really need to think twice and three times and four times and evaluate all the risks and the benefits, as well as understanding the mechanism of what happens when you're taking a drug to manipulate the neurotransmitters. So, neurotransmitters are communication particles, and they go from one neuron to the next. Very similar to hormones that work in your blood, yet neurotransmitters work within the nervous system. And there's quite a few neurotransmitters. I think there's over 100, and they create all sorts of effects. But when you artificially try to manipulate these neurotransmitters, you kind of screw up the whole communication within the neurons itself. And when we talk about depression, does depression cause body problems? Okay. Or is it body problems causing depression? Is it the chicken or the egg? Well, I think it's both because you can have a stress event, you can have a severe loss and be depressed and have that depression severely affect your physical health. But on the other hand, you could have certain types of physical health problems and deficiencies that can directly cause depression.